Guest tonight is Dr. Ken Redcross, and he's an internal medicine doctor along with being a concierge doctor.
Absolutely.
And, you know, there's so many things that have changed today, especially to become healthier. And you know that I'm going to turn 72.
I couldn't believe it, but yes.
And one of the first things that I really believe is in order to live longer, you should be eating the right things.
Yeah. Absolutely.
True.
Absolutely.
You've got one of my favorite things on the table, and what is that?
Let's see as we talk about this, because some of the things I wanted to talk about is that, you know, we're having a big issue as far as infertility all throughout the United States, really worldwide, but especially in the United States.
Right. Why?
Well, there's a few reasons for that. One of the things we know is about 7 million couples are affected by infertility each year. That's 1 in 6 couples. So this is a real issue that we need to address. But one of the things I love to talk about is exactly what you said, the diet. We take that sort of thing for granted, but we know that women who have diets that's high in animal proteins, trans fats, and carbohydrates, well, Catherine, they have a harder time getting pregnant.
And antibiotics they're taking too.
Exactly, a whole bunch of things that they shouldn't be taking.
Right.
And one of the important things is to swap out the animal-based proteins with things that we have here, such as nuts. Very, very important. Wonderful sources of protein.
What about almonds?
Almonds are wonderful. I love them. And cashews.
Milk.
There you go.
Right.
So you know where we're going with this.
Oh, yeah, we are.
And then we also have dried cooked beans, which are also another source of protein, which is also healthy and, once again, plant-based to get off of the animal-based. Now, you and I talked a little bit about this because we were wondering, what is coffee doing up here? In this case, I just wanted to remind everyone out there that keep in mind that caffeine, I know we all go on our Starbucks runs, but when you're trying to get pregnant, 2 to 5 cups of caffeine can actually interfere with conception.
Who drinks that much coffee?
Oh, come to New York. Are you kidding me?
Well, you guys are crazy anyhow.
Yeah, we have some challenges maybe. We may have a few challenges.
Right.
So you're right. It may be a little more New York, but just in case there's anyone out there in the Cincinnati, Kentucky area, at least we'll know that it's something to think about as far as the caffeine.
Well, we're on all over the country. So
we're all over, so this is for everyone.
Over, for everyone. And here's the thing. You know, I actually have changed my lifestyle, to 1 cup of coffee a day.
Okay, good.
Right. And I don't drink Starbucks, sorry about that.
That's
Every once in a while. I mean, I'm a tea drinker, and I like other things besides that. And one of the things that I'm going to tell you I love is I love shakes.
Yeah, shakes are a very important part.
But there's no soy in my shakes.
Really?
Because I'm allergic to it, and a lot of women are.
Yeah, and it can cause other challenges as well. You know, and that once again gets back to the environmental aspect, which also affects all of what we're talking about.
And I had a hard time getting pregnant, just to let you know.
Really?
Yes.
And see, it's become a bigger problem than maybe when you were at the time, and it's maybe some different reasons for what your challenges were back then.
But here's the thing. I use yellow pea extract.
Okay.
Which a food scientist that's a friend of mine actually gave me, and it's so healthy. With a banana.
Yeah.
A banana. Because guess what? I'm not getting enough potassium.
Exactly. I was going to say.
Right?
Yeah.
And it helps keep me regular, believe it or not.
For some people, it's almost an opposite effect.
Yeah, the opposite. I'm an opposite person.
And it's also great for digestion, by the way.
That's right. So I have that every single morning with my almond milk and a little bit of ice and water. And guess what? It keeps me great until I have a snack.
Well, I'm loving your diet, Catherine. So if everyone can listen to your diet, you need to call that the Catherine diet and see where that goes.
Okay, so let's talk about the nuts. How often should we have nuts a day?
You know, I usually talk about patients taking a handful of nuts each and every day. Just a handful. And you'd be surprised. That actually makes a really big difference as far as in your delta and the height.
That's actually 32 almonds.
Wow.
I counted it out.
Did you really?
Yes, I did.
You counted the almonds?
Yes.
All right. That's different.
Because that's a certain amount of calories, right, Doc?
It is, yeah.
And
about probably 150 or so.
Yeah, and you should really chew them up and really do it well, right?
Yeah, no, and that's important, definitely, to do that. So you already know about the diet, and I'm glad all the viewers now understand the importance. One of the other things when trying to get pregnant is you have to think about vitamin deficiencies. Yeah. We talked about the importance of vitamins, and when I talk about that, one of the big things that I did in all my research is I found a company called Fruitful. The reason why I like Fruitful Way is they just kind of get it, Catherine. I mean, they have this system and they make it dummy proof. I say that because if you look at the bottles, the formulation for the man says him, the formulation for the woman says her, and the formulation for the couple says couple. So it makes it easy so everyone can know which one are mine, which vitamins are mine.
Well, how often do you take them a day?
Well, I'm glad you asked, because the reason why I love this system is they have an app. It's at fruitfulway.com. The app does a couple of things. Number one, it tells you when to take the supplements and how many. So that's a big deal. But then the second thing it does, it allows the male to log into the app and gather a little bit of intel into the ovulation window of the woman.
Right.
So if you know that kind of information, that's huge, Catherine, because if I know that my wife is ovulating next Wednesday, guess what? I can come home,
ready. Right.
I can put on a little Berry White, I can bring home some roses, and say, honey, tonight is our night. So I always think about this Fruitful Way as bringing back kind of the romance into the relationship. Because what can happen when you're trying to get pregnant, it can really become quite stressful between the couple.
I feel that people get so stressed about it that a lot of times they stress so much, they really don't get, you got to relax.
No, you're absolutely right.
Spa.
Yeah, all of the above. All of the above. Especially when you're talking about stress, because stress is a killer. It's a killer for the sperm, it's a killer for the egg.
Well, that's a real killer.
Oh yeah. Yeah, that cell phone.
I want to tell you something. When you go out to dinner, a romantic dinner, and you're sitting across from somebody that has a cell phone, and they're playing a game, they're doing something, they're not talking to you. They're not thinking about you. And if you're doing the same thing, how can you really have a date night?
Yeah, no, it's funny you bring up this cell phone, because I always tell my guys, unless you're using the cell phone to go on your Fruitful Way app, then you don't need to use it right now in order to get pregnant. There was a study that showed that men who were on their cell phone for over 4 hours a day, guess what? They had a lower sperm count. And not only was it lower, Catherine, but it was poor quality sperm. So it was a double whammy. So it's one of those things that I agree with you. It's get off the phone unless, like I said, you're doing the fruitfulway.com app. That's the important way, because you need to really be focused on figuring out how to become pregnancy ready.
Well, let's talk about infertility and for a second, because it could be the guy, not the gal.
Good point, because you know, we used to always point at the woman and say, honey, we can't get pregnant, what's wrong? Well, you're right, because the guys need to know now. It's 40% on the woman, 40% on the man, and 20%, guess what? We just don't know. And that's when we get to this area over here when we talk about environmental toxins, because that's what I think that 20% may be.
Well, and also there's a test that you can take actually to find out if you're fertile or not, right?
Yeah, that's a newer test. And you know, it's interesting because not every OBGYN necessarily offers it, but they're letting you know how many eggs that you kind of have that can still be pretty much ovulated in order to get pregnant. We know that at a certain age, the levels really decrease drastically after age 35. So it's not that long.
35?
35.
Well, here's my question, because my daughter was very lucky, but in a sense and not a sense. She lost the first baby, and at 39 she conceived.
Yes, see?
Which was great, and we have a darling little 6-year-old now.
Beautiful.
Who I adore.
Beautiful.
And, you know, she had a really rough time because she was an at-risk mom.
Okay.
And there's a lot of at-risk moms because a lot of these gals get married later.
Yeah, they have careers now.
They have careers. So what do you suggest to them?
Well, I think the big thing is, once again, we're talking about diet and exercise, and we already touched upon stress. Stress is huge. It's a huge thing I talk about in my practice, because we take it kind of lightly, but we don't understand that that affects everything in our body. Cardiac, brain, physically. Stress can actually make you physically feel ill, and we actually take that sort of thing for granted and think, it's just life being life. So when you have these moms that are coming in, once again, all the relaxation techniques, all of those things are important.
And on that note, we need to get your website again, so please give that, if you wouldn't mind.
So my website is drredcross.com, drredcross.com.
And we'll be right back.